You're listening to Chicago Stories, a podcast from City Hall featuring the stories of everyday Chicagoans and special guests, as told to Mayor Emanuel.
Mayor Emanuel, Chicago Stories. We're here with Dr. Helene Gayle from the CEO of the Chicago Community Trust. Did I get it all right so far?
Got it right.
There, end the show. So you studied medicine.
Right.
Can you give me the
from there to here?
Yeah,
right.
And the Gates Foundation. So what led you from medicine to one of the largest philanthropies in the United States and doing kind of community investments?
Right.
And what kind of healthcare did you,
right.
or medicine did you study?
Right. Well, it's a unusual journey, I guess. I studied.
Ballet dancer to mayor.
Well, that's true. Yeah,
we have a big bandwidth of unusual.
Yeah. So I did pediatrics and went into medicine partly because I thought it was a tangible way that I could make a difference. And I always had a real interest in, how do you create positive change? And but I also was practical enough to know that it would be good to have a tangible skill, and medicine is one of those skills. But when I was doing pediatrics and in a inner city teaching hospital in Washington, D.C., you'd see a lot of the kids who would come in and out of that hospital, and you realize that it wasn't just about the disease process. It was really about systems and whether or not we had adequate systems, and did we have the right policies in place, and so many other things that really impact health. And so I started thinking about public health as a way of having a greater impact than you do as a clinician taking care of individuals. So, as a clinician, your patient is an individual. When you focus on public health, your patient is a nation or a community, or even the world. And so I went on, after getting my master's in public health, I went to the Centers for Disease Control and thought I would stay there for 2 years in a training program that they have. And
this
stayed
down in Atlanta,
and stayed for 20 years. And so
they both have a 2.
Yeah, right. They both have a 2.
2 and 20.
Exactly. And I went there at around the time that the HIV epidemic was just starting to unfold. And got very involved in the issues of HIV and AIDS, first at a national level and then globally. And I think HIV teaches you a lot of things. I think it teaches you a lot about how diseases are distributed that have, again, less to do necessarily with just the virus, but people's vulnerability in society. And so I did a lot of work on HIV in the United States and preventing the spread of disease, but then also got very involved in global HIV and looking at the issue from a global level, which then led me to the Gates Foundation. It was right around the time that they were starting their focus on global health, and it said that HIV would be their highest priority. I got recruited there at an incredibly exciting time. I mean, the foundation was just starting out. It was a couple years old when I got there, so it was fun to be part of those very early days and help them to get their global health programs up and running, and got a call from a recruiter asking, well, now that you've done that, what about global poverty? So, thinking about a lot of... Now you got that on the wrap.
Right.
I got, it was during those early days of HIV where we got a lot of stuff started with PEPFAR and all these other things. And so, when I got a call to think about heading a iconic organization, CARE, that started care packages and relief after World War II, the chance to really work on what we now call the social determinants of health, all the things that we know are kind of the root causes of health inequities, and look at those issues of economics and adequate nutrition, clean water, all of those things that go into trying to lift populations out of poverty. I said, sure, why not? So, and then fast forward, having done that for about a decade, I, like so many other people, started really worrying about America and some of the issues of inequity that were left untackled here. And at a time when I think our standing in the world was in question, what we stood for as a nation. And so I was drawn to the opportunity to take a lot of the things that I had done nationally and globally and look at them from a local perspective in a city that I think has the potential to really demonstrate what it takes to make a difference in some of these issues of inequity, but also I think can be a model for the rest of the nation in many ways.
I got like 4 questions now. One, do you think healthcare is a manifestation of poverty and all the other things, or a contributor? And it doesn't have to be one or the other. 2, given that we're, I wouldn't say on the cusp, but I know as the mayor of the city of Chicago, getting to zero, if I had told you 20 years ago we'd be at a point on HIV of talking about zero. So what lessons do you learn from that mobilization, that if you took the issue of educational disparities, income disparity, any one of those issues, what lessons can we successfully learn from that? Because it is kind of, when you take a singular disease, or not disease, illness, HIV, and we have done an incredible job, not just medically, but otherwise in organizing and transformed from where we were 30 years ago, 25 years ago. So one is, the first part is about the chicken and egg. Is healthcare a manifestation or a contributor of, in poverty, and more a reflection of that? And then second is, are there lessons to be drawn by the way the world or the country mobilized on HIV that it could take on other kind of public health issues?
Yeah, sure. So I think health is both a cause and a consequence of poverty and economic inequity. Clearly, the cost of health care drives some people into poverty. And I think when you're not well, you often have greater absenteeism on jobs, et cetera, et cetera. So there's clearly a causative aspect of it. But I also think, one of the projects here that I've been most impressed with is West Side United, that has taken on the issue of the social determinants of health, recognizing that this disparity of 16 years of life expectancy between the Loop and the West Side
and Garfield.
And West Garfield is not just about quality health care. It's about the fact that people don't have jobs, access to education, safe neighborhoods, grocery stores, et cetera. So all of the conditions that lead to a state of poverty are the very things that lead to poor health and health disparities. So I think you can't tackle one without the other. Yes, we can continue to have better medical and health improvements, but that's just the tip of the iceberg. So that's one. On HIV, I think there's an incredible amount that I feel I learned through that. One was humility, a great deal of humility when I think about the people who were on the front lines of that epidemic early on particularly. But a lot of what we did in the early days was, before we had great drugs, and we were talking about particularly prevention, was how do you work with communities better? Because if you're talking about decreasing the spread of HIV, you've got to be aligned with communities and really thinking about how do you talk about some of these issues that are so sensitive, and how do you take the stigma away in ways that people are then willing to seek help. So I think one is, how do you work with the people themselves? And as we all know, we would not have done as much about HIV if the community had not risen up and literally, we had some tense times being locked in our offices and all sorts of things. So, the community response was incredible. But I also think the political will was important. And I saw that not only the lack of political will in the early days of the AIDS epidemic, but when we did mount political will, and from some of your years during the Clinton administration, there was a much stronger approach. And globally, when I went to countries where people were in denial and political leaders wouldn't talk about it, you get a very different approach. Adequate resources. Again, when I think about what it was like in the early days and the lack of resources that were given, and then when resources were mobilized at the scale of the problem. So I think, having a plan, making sure that you're actually working with communities that are affected themselves, continuing to think about political will, resources, and as always, looking at the issue, thinking about what are the root causes, and making sure you're tackling those root causes as well as the consequences.
So let me ask you a question. What takes you from a global issue to want to take Chicago Community Trust on, which is very local, and not that the issues don't reflect certain things that are going on globally or nationally? Go from there. What made you walk off of that global stage on a global issue and take on what Chicago Community Trust does, and it's the largest foundation, or one of the largest foundations in the United States.
Well, I think, first of all...
For a pediatrician, that is, obviously.
As I said before, I mean, I really did, after spending 20 to 30 years of my career focused globally, took a look at where we were as a nation and really got concerned about that. But I think that it's also been incredibly satisfying to come to a place and feel like you can have an impact on the place that you live in. And, Chicago is an incredibly captivating city. There's so much dynamism in the city. It's definitely a remarkable experience to be able to live here. But there's also some real entrenched problems. And so the ability to work in a city where people care so deeply about their city as they do here in Chicago, but also realize that there's issues that have been longstanding and there's a need for change. It's exciting. I feel like if I can make a difference here, I think that
you can make a difference anywhere.
Well, it's a model. I think Chicago can really be a model for the nation.
I always tell people it's a hard thing to convey to outsiders. The way people wear their passion.
Yeah, it's incredible.
It's like no other city. Yeah. So let me ask, you have the community trust. What did you learn in the first year? And when you think about your goals, 5 years hence, 10 years hence, when you're done, what do you want them to remember about what you've done and what the Chicago Community Trust is today?
Yeah, so I think one of the things that I learned, and I've said this over and over again, I think is this sense of civic pride and that I think is rare and really unique to Chicago. And I think it means that there's a lot to work with here. I also, in talking to people, realize that again, I think that people have a real concern about the inequity that exists here, and figuring out ways to have an impact on that. The other thing, though, is, it's just amazing to go throughout this city and see what individuals and groups are doing. I mean, there's some great stuff going on here. And so I've just loved seeing the different models of change that are going here. And I think there's just such a great opportunity to coalesce that, bring that together, and have, really catalyze change. We've taken as our highest kind of overarching priority looking at how do we really tackle this issue of economic inequality and looking at ways in which we can help to stimulate growth, particularly in disinvested communities, and work on that. And so to me, if in 10 years from now, we see that we've done some things that at least provide examples for how you create economic change and start healing some of that divide and bringing together, building assets in communities that for a long time have not been invested in, I think that will be a real...
I think the biggest challenge, big metropolitan city, or a city like Chicago or New York or Los Angeles, Seattle, is, we call it income disparity, but what I call it is inclusive economic growth versus exclusive economic growth.
Right.
So what are you doing at Community Trust to... where are you redirecting dollars at? What are some of the things that when you change, not just the purpose, but how you fund what you're funding? How's that kind of manifesting? That's the issue, because it's larger than a foundation.
Right.
You can't do it just on the back checkbook at Community Trust.
No, exactly. And, we're still in the process of kind of doing some deep study and thinking about where can we have the greatest impact. But I think one of the things that we have, that I think we've not used is who we are as an organization, because you can write checks and you can provide grants, but I think there's more that we can do as an organization that has been here for 104 years, where there's a lot of sense of trust, and I think we can be a neutral convener in ways that bring partners together. For example, I think there's a lot of opportunity to coalesce a lot of the efforts that are going on. So one is, I think we want to use who we are as an organization differently, use our voice. We've not been as involved in policy that I think that could make a big difference. I was on this task force that looked at expanding EITC. The Earned Income Tax Credit is a potential game changer for a lot of people's lives. And if we can continue to think about ways of expanding that and innovating around that, I think that could have a big impact. So I think there's a set of policies that we will look at. I think working with others to think about catalyzing small and medium-sized entrepreneurs. You know, there's a lot of entrepreneurial spirit in a lot of these communities, but it just hasn't been tapped, and they haven't had the kind of mentorships, and they haven't had the kind of capital kind of in a concentrated way. So I think we want to focus on that. You know, you've done a lot looking at this whole, how do you make sure that young people who are graduating from college actually think about a plan of action for their lives. And there's more that I think we can continue to do to build on that, to make sure that young people end up having well-paying jobs and careers that are the first step to creating assets. So, you know, those are some of the things I think we want to think about. How do we make sure that people have careers and income and pathways? How can we help to increase economic opportunities and activities in communities that have been disinvested? And then how do we look at some of the policies that could actually make a difference to provide those kind of safety net, financial safety nets, so that people can actually begin to think about asset creation?
See, to me, key word you said is disinvested. I've made this point before, I don't know, somewhat controversial, but it's not so much a tale of two cities as a tale of two different investments.
Yeah.
One got invested and one
Right.
did not. And what we're seeing today really took decades of basically step-by-step disinvestment that basically left a whole community left behind.
Right.
And reversing that kind of flow of dollars, both to the individuals, the neighborhoods, and the communities that support it.
Right.
And it's really more of a disinvestment than it was. One got invested and the other one never got invested,
Right.
and that changed it.
Right. And that's the difference between inclusive economic
Right.
growth and, you know, non-inclusive economic growth. And to your point, it took years, and so I'm not unrealistic to think that it's not going to take years to actually reverse some of that. But it's also not something that is not doable, you know.
So I will give you one of the things, I wouldn't say the biggest revelation, but a revelation as mayor. We did it, and you know about the hatchery on the west side of the
Right.
food, that you have food deserts. And food deserts are mainly thought about as grocery stores, but it's also seated restaurants, not just drive-thrus or fast food, real family community type restaurants that don't exist, coffee shops, a whole piece of the community. But every grocery store we've opened up, either in Englewood, in Bronzeville, in Woodlawn, we've made them kind of tap the entrepreneurs in the food space that are in the community, and it's overwhelming.
Yeah.
So what's it's a bit ironic to me, is you have a food desert, and yet some of the greatest amount of energy of entrepreneurs are people in their kitchen who have done
Right.
their baking, all their food products, or other types of things that belong in a grocery store. And it's like this incredible energy that's been building up, and it's weird.
Yeah.
I mean,
right.
I don't know how
But
else to describe it.
It's giving it a place now to rest.
I mean,
Yeah.
Englewood Whole Foods has about, I'm doing this by memory, about 30 products that are made in the
Englewood,
neighborhood of
yeah,
Englewood
right.
in people's kitchens.
Right. Yeah.
Same thing
Right.
in Woodlawn, same thing
Right.
in the Marianos, in Bronzeville. But it's ironic that you have a food desert where I don't think you can go in other parts of the neighborhood where there's a lot of grocery stores where you have that much entrepreneurship around food.
Right. Yeah, and I think it just shows how much talent there is that needs to be unleashed. And once you give it a place to actually sit, you know, it makes me feel very optimistic.
Do the MacArthur's, the Community Trust, the Joyce, you all sit together and plot about why we're all screwing it up here in public life?
Well, I don't know if that's exactly how we title our
I
gatherings.
don't know why paranoid people think this way.
But we do. I mean, that's the other thing that has been wonderful. This is the most collaborative philanthropic community I've ever experienced. And we do. It's a great community to sit around. And, you know, I think we try to complement each other, but we also come together. You know, the Safe and Peaceful Communities effort around violence is one of those examples where we've come together, pooled our resources, you know, and have done a lot, I think, to make a difference in what has been a real difficult issue.
Take violence. If you had a magic wand and say, okay, and you said you wanted to start branching out to policy, that was my big revelation in the Clinton years. The EITC, I mean, we've done stuff as a mayor on I think the EITC is a totally way underappreciated social policy.
Right.
And one of the most successful economic and social policy. What would you, if you could start, what would you do? Give me the 4, 5, 6, 7, 2 core issues on violence.
Well, you know, I think first and foremost, I think the root cause is the same root cause, is that there's these huge communities where there's been disinvestment and people don't see hope and they don't see a way out, and they're in very closed environments. And so, I think long term, those issues have to be tackled. But in the short run, I look at violence as a public health issue. You treat it in the same way. You disrupt the spread, the transmission, by looking at, can you intervene at the site of immediate conflict? You really look at targeting your efforts, because I think, while there are programs that we should be doing that look at young people who are potentially at risk, we know that there's a concentrated group of young people, particularly young men, in particular neighborhoods, and that's where we ought to put our resources and our efforts. But, the thing I hear over and over again for most of these young people is, if we had jobs, if we had things that gave us livelihoods, we wouldn't be in this world that leads to crime and violence. And so I think making sure that we give young people and people who are involved in violence opportunities to get out of that life in the short run.
So let me press this point, because when I walked into the office, you had people, employees looking for employers. I'm walking out, you have employers looking for employees. It's kind of in totally reverse. Right. And all the barriers, prior record, everything that used to be a showstopper, employers are blown right past. And while we have the lowest unemployment, you have not massive, but you do have significant help wanted signs. So how do we get the people, if you and I looked out our window, or you got upstairs and you and I looked straight down Chicago Avenue, straight down Madison, we could see, and if you had binoculars, you can see men hanging on corners 3 miles out. How do we connect those men who don't have an education and don't have a work experience and get them into the mainstream, mainly of work right now at this point in their lives? Because whether it's truck driving, or hotel, whatever it is, are ready to hire in a way that they weren't before. And I do believe that, I don't know 10 out of 10, but I would argue that there's probably 7 out of 10, they're ready to choose this alternative life to the one they have. How do we make that, and where can the community trust in the city? It is one of the, I'm gonna walk out of here, that's one of the puzzles, because I think I don't know in 5 years you're gonna have the same employment situation.
Right.
And if we miss this window, we're missing a third chance at that generation of men. Yeah,
no, I agree. And I think, some of the programs that are doing that well, I think are kinds of programs we should invest more in. People like the work that Arnie Duncan is doing, or Rami Nabashimi. And, some of those programs that are really working with these populations and doing a really great job of finding those men, because you have to have people who are trusted. You have to have people who are trusted, who have built a track record, so that when you start coming and saying, here, we've got jobs for you, they're trusted. On the other hand, I think we also don't do enough of making sure that we give people the supports to stay in jobs, because we're talking about people who oftentimes haven't had modeled what does it mean to go to work every day, and why is it important to be there at the right time, and what are the other things that are keeping you personally away? Do you have mental health issues? Do you have childcare issues? Do you have other social situations? Do you have transportation? So I think we often think about connecting people to jobs, but then not thinking about, are we making sure that the rest of their needs are met so that they can get to that job every day, and that we give them the support that's necessary. But I think, again, it's one of the things I've been really impressed with employers, as you said, who are willing to take, quote, risk, because they've seen that if, in fact, they put the right effort in, you can take somebody and turn their life around with a job.
I mean, this, the CTA is the largest ex-offender hirer in America. Right. And when that person makes that decision, they're going to make a change. I bet long on them, because they've made a decision. They don't want to go back. Right. And they're ready to put some skin in the game in a way that somebody else. Yeah. And the pride that people have, you see it. To be able to have a job, bring home money, support families, support children, it makes a big difference. I'm listening to you, and first of all, my dad's a pediatrician, so I hear I hear this clinician all the time. Do you think you could do what you're doing without that medical Was there another career you were thinking of besides pediatrics? Not career's wrong, but profession. I hear a doctor, and I'm sorry to transport myself to my family dinner table with my parents.
Well, I thought about being a lawyer, but I had two sisters.
Thank God.
I had two sisters who went ahead and did that. So I said, forget it. I've got to do something different. But I do think that, the training that I got was very helpful in thinking about analyzing problems and how do you go about finding solutions in kind of an analytic way. So I'm sure I could have been something else, but it seems like it fit.
Now we're going to test your knowledge of Chicago.
Oh, God.
Don't worry. It's a pass-fail test. It's perfect. Cubs or Sox?
Sox. My husband's from the South Side. I have no choice.
Yeah, okay, there it is. So that's not really your own vote? Okay. Thick or thin pizza?
Well,
go ahead. You can do whatever you want. Yeah,
thin, because I'm of a certain age where you can't have a lot of dough. That's all.
Or it takes you 3 weeks to deal with it.
Yeah, exactly, to get it off.
Sears or Hancock?
Sears.
Wow, that was quicker than all.
Hey,
Okay.
I grew up with Sears.
Lake or river?
River. Lake.
Okay, that's fine.
Yes,
that's
lake.
Fine. 12-inch or 16-inch softball?
I
don't know that?
I do, yeah.
Well, we're going to have to expose. Yeah, Chicago's famous for 16-inch softball, so you got to tell your staff at the community trust.
We'll have to have a softball match.
Yeah, that you want instructions on what. My recommendation is, all your knuckles are in place. Don't play 16-inch softball. That's not. Dr. Helene Gayle from the Chicago Community Trust, thanks for being here.
My pleasure. Thank you. And thanks for all you've done for all of these years. Public service, I think, is underestimated, and you've been an excellent public service, not only here, but for the nation. So thank you.
Thank you.
You've been listening to Chicago Stories with Mayor Emanuel. You can subscribe and leave a review on Apple Podcasts and tweet your guest ideas using #ShyStories. Thanks for listening.